Hi, my name is Visa, and I'm from the small township called Masipumelele, and I have been coaching for Ways for Change for the last 5 years now.
I had an experience of losing a friend in the water, and I came to Ways for Change, and they were about water, so I had to be strong and have to face the challenges that they had.
Hi, I'm Coach Amber, and I'm from Lavender Hill. I've been coaching for Ways for Change for the past 3 years.
Ways for Change provided me with life skills to think more positive, to have a positive attitude and positive thoughts. Now I'm a caring adult trying to make a change in kids' lives.
Wave, wave, that wave, that wave, on that wave, you on that wave, you on that wave, can be on that wave, I can be on that wave, dreams I can be on that wave. Dreams I can be on that wave. Dreams I can be on that wave. My dreams I can be on that wave. My dreams I can be on that wave. Listing my dreams I can be on that wave. Listing my dreams I can be on that wave. At least in my dreams I can be on that wave. I can be on that wave.
Let me start by asking you a question. What are people here in my community? What are they most frightened of? What can I tell you about my Khayelitsha? This is the world I live in each and every day. Khayelitsha is one of South Africa's biggest townships. My name is Luxolo, Lux Pongo. I was born in 1997. Crime, gangsterism, violence, you grow up being exposed on it here in Khayelitsha. My community and the community next to it, like, they will fight with sharp blades, pangas, and knives. The war wasn't optional, like, you weren't asked, do you want to join or not? To protect myself, I joined the gang. When you're in gang, you feel protected. You feel untouchable.
I think everybody in my community is pretty much connected. So if we're speaking about gangs, then almost everyone is related to it. What we're doing is we're being abused. We take these kids and we teach them how to be better people from inside, and we fuse that with the rush of surfing.
When I was 14, the founder of Ways for Change came to my school. They were looking for children who have been exposed or were suffering with trauma and wanted to find a way to heal them. Ways for Change is a non-profit organization that uses surfing as a tool to educate children, to equip them with good decision-making, coping skills, giving them a safe space, and also giving them better opportunities. I was one of the first one from my community to pick up a surfboard and become a mentor.
Immersion is one of the first activities that we do. This is basically the first time that all kids are experiencing going into the water. Most of them are filled with fear. They've never been into the ocean. Some of them have heard stories that they're gonna die as soon as they go under a wave. So we take 5 steps in and then we stop. And then we ask each other, are you okay? Are you okay? Are you okay? Once everybody says that they are okay, we take 5 more steps. if somebody is not okay while we are all holding hands, we stop and we turn around and then we walk back. So basically what we're teaching the kids there is to protect each other and respect each other's feelings and also share each other's feelings by showing empathy.
Surfing is a way of making you a better person. The way you see things, how you make decisions. Because to make an example about myself, when I surf, those waves who are breaking in me and I want to pass them to go to the back, I simply take them as challenges. So they are challenges, they are pulling me backwards while I want to go forward. Surfing has taught me that in life you have to be resilient and you won't find everything that you want now. Like, you have to never give up, bounce back each and every time.
I've seen a kid being so terrified, but then a wave just pushed her to the front and she was like, whoa, can we do that again? She absolutely loved it because what she thought would happen didn't happen. She didn't drown. And that was one of her biggest fears, was drowning. And then in that moment, it was so amazing to see that smile on her face because then she was excited for me to teach her how to swim. And I felt honored that she was asking me and trusting me to do that. So it really is a breakthrough. Like kind of smashing into the wave would be a physical breakthrough. For her, it was kind of like, wow, like a mindset. I can do this. So they feel like they achieved something. The solution to my community has to basically come from my community. So the people inside it can help each other. And young people are what is going to change. We don't want our kids to grow up in the same fear that we are growing up in. So people in my community can relate to people who stay there and know what it's like to go through what they're going through. I think also it's powerful because the emotion that people feel from someone else who goes through things that they go through is you understand and you relate.
Waves for Change said to me, the project wasn't about them. It was about making me a mentor, a role model, for me to then take my own breakthrough back to my community. Say, me being with the kids in the ocean is the best thing. They remind me when I was their age. Most of them, you can see that the ocean is the only place where they feel welcome, where they feel the sense of belonging, or where they have hope. I believe that sport has the way of changing the world and making everybody see hope or see a future the better way.
The moment that we see a kid standing up on a surfboard for the first time is probably the most exciting thing that we experience in the water. Because everybody notices in that time, and what we teach our kids is TLC, we tell it, we label it, and we celebrate it. All of us here in South Africa, we're equal. We come from the same country, we live in the same country, so where we go shouldn't be limited because of status or who we think we are. We're all from the same culture here as a South African.
Well then, good afternoon. I think it's past 3 at the moment. Welcome first of all to those in the room at the Hyatt Regency in Cape Town. If you do not know where you are, you're on the corner of Whale Street and Buitengracht Street in case you need to be fetched later after the wine. but that you are just in an iconic space. You just, my back is towards the Boekap of Cape Town, so we're in a very iconic space at this stage. I hope that your entry was welcoming and that everything went smooth for you and that your snacks was nice. And to those people who are at home, not enjoying this live moment with us, you are allowed to open up a glass of wine while you watch the proceedings today. So welcome to each and everyone that has made the time to be here this afternoon at this auspicious event, which happens annually. And first of all, my name is Ezra Overberg. Don't worry about the last name, just that you can remember Ezra, okay? So that you have to scream at me and say something to me. My name is Ezra, spelled with an S and not a Z. So I just want to say thank you to Waves of Change for allowing me the opportunity to MC this moment. I remember quickly last year, Tanya and the team was in a venue that I ran for 3 years in town. And the reasons that we closed businesses today, we just blame it on COVID. It was tough for entertainment and places like to open, so she has called me back to provide this venue for them today and for me also to be the MC. So I'm very honored and thank you very much. And first of all, what we need to do is give yourselves a warm round of applause for looking nice and making the time out of your offices today to come here. This is the Waves for Change event, and here we are going to turn the spotlight, or they turn the spotlight mostly on children in mental health. And it says Waves for Change for a reason. You guys must by now know, and if you're not going to know, the presenters will present that today as to what this beautiful organization does in the mental health space. The purpose today is to raise astute awareness for mental health and also to give you, the practitioners and the specialists, or the partakers in the mental health stream, an opportunity today to speak to and be spoken to in this area of mental health. And of course, I see you all have red ribbons on you. I hope everybody knows why. And I see some people have got green on just so that they could hide and camouflage the ribbon as well over that. So kudos to you. It is Mental Health Awareness Month in October, which we all know. And so this day is purely for us to reiterate that and for the speakers to come up to say their say and to talk about the topic. It is extremely important that this is the overall objective for them to raise awareness. And you guys do know that there's been a significant increase in mental health challenges in young people. It is going rife. When we look back at COVID, we saw more things happening because the health society was under tremendous stress going out to these people and leaning a helping hand to them. It's very bad to do it remotely. We could have our meetings via Zoom, but we could not always go and care for those in need. So yeah, great thank you to you all for being here. And now give me a round of applause for looking nice, just before we start. All right, so Waves for Change is also changed the way we do conferencing. Waves for Change has changed the way that you give feedback. I'm also a feedback engagement specialist, so I like feedback, so I take criticism very well. Not on my dress code, no. I take offense when you tell me the suit doesn't look good. So that's the only feedback. Please do not give that to me to my face. Send that to me anonymously, so I don't know your name and your surname. But let's rush through quickly. So we're using a software today whereby we are not going to be passing the microphone around. Has everybody got a smartphone? Yes. Grab out your smartphone. Click up the QR code on the screen very, very quickly. And I want everybody to participate in this because we've got a nice poll that's coming up now that we're going to engage on. If you bear with me quickly. So if you're struggling to scan, it's not a problem. You could also just go to your web browser and you type in slido.com and Slido will ask you to join. And the joining code is Waves for Change. Not yet. I would like to see who's all hopping into it in terms of the numbers. Just zoom with your phone quickly and scan on it, or just go to your browser, which is even easier, slido.com, and then the joining code, Waves for Change, one word or underscore. You see, we're in classroom today. You were quiet, and I'm giving you homework to do. All right. What's the numbers that we got engaged there? $36. Okay. All right, everybody on. So now if you are on, there is a poll that's live at the moment. I don't know, can you see that poll that's live? Anybody, can you just tell me yes or no? Yes, no? If you don't see the poll, hold on. Ethan is going to make the poll live. That's my son, Ethan, at the back there, which is running the poll today. There we go. Okay. Let's play on the poll. Is everybody on? Slido.com, waves. There we go. People are on the poll here. I can see them. There we go. There we go. It's fine. It's not a problem. You are in Q&A. There's 2 buttons on the top. I want you to go into live polls or just polls. I'm going to explain the Q&A. I don't want to explain that before time, guys. I'll give you the reason why. Because then you're going to ask all manner of questions. Right. You're on the poll. Good. So can you quickly vote on that poll for me quickly? Everybody, can you vote on the polls? Answer the questions. Yes, help your neighbor, help your neighbor, help your neighbor. Let's go. Just leave it there. Yeah. Keep asking. Who's the person sitting next to you? The word cloud is working. It's working. There we go. Haley is still the most common person here. Haley is still the most common person. There's too much Haleys here. What's happening here, guys? Good. Ask the person next door what their name is and type the name in. Let's build the cloud. Let's build it. Yaku Ronel Apish. Apish is going to be one of our presenters here, one of our speakers. Can we get some more names? There's about 70 odd people in the room and only 45 is engaging. That's a bit low. Can everybody come up and join us? There we go. So at least we have an idea of who's all in the room, and it's still growing. It's still growing. There we go. Apish went away. Now it's Ronald is the common one. Aviwe is very common. Yaku is very common. How many Yakus in the house? Dina is there. Good. All right. Okay, so we got 50 people engaging, which is not bad. It's 80% of the room. Thank you very much for doing this. Can we liven up just the next one quickly? There's another poll quickly. Can you just liven that up? What is your energy levels? I see people have already voted. Wow. Medium. Who's the medium person? Lots of people is high in their energy levels, excited. There's ecstatic. And there's, of course, lowish, which is the new word now that they use, lowish. And there are some people that is saying that they're feeling stage 2. Don't worry, Hyatt Regency has got a generator. We're not going into any stages, guys. All right. Can we pop up the next one quickly? Right. Is this your first time at the Hyatt Hotel? Okay. That's everybody that voted. There's an extra person coming on. Yes, so there's a high number of the first timers that's been to the Hyatt Regency Hotel, which before was the Hilton Hotel. All right. Okay, so that is how we're going to engage. People, also, I'm going to be giving away these beautiful prizes for the Love, which is the South African Surf Journal. I'm going to give this away for those people who's engaging the most on Slido, right? Why is it important to engage? Is so that we don't do all the talking, but you also do the talking to us. Is that okay? Now, Q&A. Q&A works very simple. When the speaker comes up and they present a topic, you can ask any questions. We're not going to pass the mic around to you. We've done a study that 74% of people in the room are introverts. The introverts don't like to put their hands up and they don't like the microphone. And they have the best questions. I'm not saying the extroverts doesn't have the best questions, and the extrovert always has the best statement. You recognize yourself? I would like to say something. I feel that you could have done better here and there and so forth. That's the extrovert. But not in this room, of course. The extroverts here are disciplined. They ask proper questions. So you can ask your questions. I get all the questions on my system. When the speaker stands here, I come up and I read out your question to the speaker, and that speaker answered you. So it means we get a lot of questions. If we miss out some of your questions, the speaker can go and sit in a corner there and reply to you, to your cell phone, what the answers are. Happy with technology? Waves for change. We're doing some change, right? Awesome stuff. Give that system a round of applause. We're going to keep engaging. Right, so we're going to kick off with a very special person that I'm going to have the honor of bringing to the podium. And this is the National Director of Waves for Change. An extremely versatile development professional with over 15 years of experience in the NGO sector. Robin believes in collaboration and through her extensive network promotes partnerships and consortiums working within the NGO sector in South Africa. In her role as National Director of the award-winning NPO Waves for Change, Robin is leading a team delivering high-quality mental health services to vulnerable and disadvantaged youth in South Africa through an innovative serve therapy methodology. Please welcome with a warm round of applause, Robin Cohen.
Thanks, Ezra. I'm normally one of the introverts in the room, but I've been asked to welcome everyone today, and it's a pleasure and an honor to be here and to welcome you all to our event today, Closing the Mental Health Treatment Gap in South Africa. I'd like to welcome everyone here in person, and as well as our online guests from around the globe. Wamkilekile. A special welcome to the Department of Health, Department of Social Development, members of Parliament, members of the City of Cape Town, government officials, media, partners, and friends. A special, very, very warm welcome to our two guest speakers today, Stella Mokotimi and Nishan Peton, hiding in the background, who you're going to hear from today. On a personal note, it's very rewarding for me to be here today. I'm a registered nurse who worked in the clinical space for many years, and I understand the challenges that we face in finding innovative, relevant, and affordable ways to service communities and children dealing with the most adversity and the most in need. Since joining Waves for Change more than 5 years ago, we have grown and strengthened our referral networks and pathways, making our service more accessible and responsive to the needs of the communities that we work with. Before I hand over back to Ezra, I just want to, last but definitely not least, make a big shout out to our Waves for Change coaches who couldn't be here today because they're out there doing what they do best, being caring coaches, delivering program. But I just, in the Waves for Change tradition, we do big snaps for them. Thanks again for joining us today. As we say at Waves for Change, we are together, we are one, simunye sisonke. Enjoy the rest.
Thank you, Robin Cohen, the Waves for Change National Director. Ladies and gentlemen, I already see questions flying up on the Q&A. While you were talking, Robin, I don't know what they want to ask you. Someone has just typed, so you can be anonymous, or you can put your name and your surname and your whole company profile in there. That's going to be very important for later on when we want to get to your checkbook and your credit card. And that's important, okay, because there's going to be something coming up. So, well, let's just pull this question up. How do you take care of your well-being? So, I'm going to leave that pressure up to maybe the next speaker, if we could. And then, of course, someone just asking what's next, not lunch. But yes, let's move on. May I just ask if the speakers comes up? Well, the next one is ready. So I'm just going to read out and bring this lovely, bubbly lady up to the podium quickly. I've had the blessing of meeting her earlier. And she just says, yes, it's okay, everything's fine. You know, no complaints. Wonderful human being. So she is the Deputy Director, Comprehensive Health Programs, Department of Health, Western Cape, Khayelitsha Eastern Substructure. That's a mouthful. She has a nursing degree from the University of the Western Cape. She is registered with the South African Nursing Council for the following qualifications: General Nursing, Psychiatric, Community and Midwifery, additional qualifications in Clinical Nursing Science, Occupational Health Nursing Science, and Nursing Administration. The kind of woman I want to live in my house. In addition, Nishan holds a BTech in Primary Health Care and Nursing Management, Master's Degree in Administration in administration and a master's degree in public administration governance. She also has a certificate in advanced health management and a post-basic qualification in middle management development. She has completed an executive development program for public services manager, and she also participated in the IVPL program, which is the International Visitors Program for Leaders, Public Health, African Region. She also has a postgraduate health management qualification with the University of Stellenbosch. Deshawn is currently enrolled in a value-based leadership development program. Ladies and gentlemen, please welcome to the stage the beautiful lady, Deshawn Patton.
Am I good? Alright. So, good afternoon, goeiemiddag, Mulweni, honorable delegates, and thank you for the very warm welcome. Yeah, I'm an Enneagram 2 and an introvert. So I'll be the one in the corner answering all the questions on the slido.com. Thank you very much to Robin and the team for inviting me as a guest speaker. I represent the Department of Health, Western Cape Province, or should I say the Department of Health and Wellness, and I'm also joined by my colleagues, Dr. Stella Mukatini, Emerald Spillman. We also have Dr. Josias at the back, and colleagues from the Department of Social Development. All protocol observed, just to cover everybody. So I'm going to be looking at my slides from here. Would you be displaying it from that side? Perfect, thank you. So, so as the introduction said, I'm representing the Metro Health Services, Khayelitsha Eastern Substructure. So basically, in a nutshell, the Western Cape Province has got a metro district, which is divided into 4 substructures because of the population size of Metro Health Services as such. And then we have 5 rural districts, which is Overberg, Cape Winelands, Central Karoo, Eden District, and that makes up the Western Cape Province Department of Health and Wellness. So I'm going to be speaking a lot about something called strategic partnerships, and health is everybody's business. Okay. So I first met Patience and Robin and Phaahla and the rest back in June when I joined the Khayelitsha Eastern Substructure team. And like Robin said, on a personal note, you'll see there's a photo of me in front of Waves to Change at Muizenberg. So I have these 2 reasons that I've kind of latched onto Waves for Change. One, my husband works as an offshore pilot and diver. So these containers, I was fascinated by that. And that's also why I had to take the selfie, because most of the time I'm alone. So we visited, the team and I visited the Monwabisi Waves for Change offices, and I also went to go and introduce myself to the Muizenberg team. And I must say the work that they do is amazing. I'm a mother to 3 teenagers, 19, 16, and 14, and sometimes I feel I can't relate to them. So when we engaged with these young, with these youth and adolescents, given their backgrounds, it really resonated with me, and it left a footprint in my heart. Next slide. So for Khayelitsha Eastern Substructure, the population is approximately 1.2 million. So this is still census 2011 data, so it's still outdated, and there's a slight typo. The percentage of youth and adolescents under the age of 19 is actually 33.1%. So a significant percentage of the population is under the age of 19. These youth and adolescents in their everyday lives have a lot of psychosocial stresses, poverty and family issues, exposure to crime, and high unemployment rate. So this is what you face when you stay in an informal settlement such as Khayelitsha. And Khayelitsha is made up of Kuyasa, Side B, Side C, Harare, Makaza. It's different from Makassar. People think Makassar and Makaza is the same, completely different dynamics. And so these are just some of the psychosocial stresses that these youth and adolescents are faced. And that is why the Department of Health needs to work very closely with the Department of Social Development, using the whole of society approach to be able to assist these youth and adolescents in overcoming or dealing with these psychosocial stresses. The Department of Health, so I just wrote DHS there for CARES. The district healthcare system, basically, if you read up on the National Health Act 61 of 2003, it articulates for you what the district healthcare system should look like in South Africa post-apartheid. But our reality on the ground is very different. So with the population that we have in Khayelitsha and Eastern substructure, we have 3 district hospitals. And our district hospitals is Khayelitsha District Hospital, and then we have the Helderberg and Oostenburg basins respectively. We've got East River District Hospital, and we also have Helderberg District Hospital. And there's a reason why Dr. Josiah and I, which comes from the Child Trauma Conference at the Lagoon Beach Hotel earlier on, we had a lovely chat. So I've put down there something called the package of care. So even if you are youth and adolescents staying in our geographical area, Khayelitsha and Eastern, and you are a sexual assault survivor, not a victim, a survivor, you might end up having to go to the Tutuzela Center at Karl Bremer, where Dr. Josiah's works, which is completely outside of our geographical area. Why? Because the geographical area boundaries for SAPS, for Department of Social Development, Health, and the Department of Education is different. So someone coming from an impoverished background, exposed to crime, then has to go through this journey. And you have to interface with a number of healthcare providers and other providers, whether it be the SAPS officials, the Department of Social Development officials, and tell and retell your story multiple times. Our district hospitals also has 72-hour observation units. Unit sounds a very fancy word, but it's something that Stella has put in place. And I remember David Binz's words, he's the CEO of Khayelitsha District Hospital, the other day, when he said, I invite you to come and have a look at our unit. It's actually just 3 beds. And if you go according to the National Health Act, it tells you all about, and the amended Mental Health Act, it tells you what these units should look like and the staff that it should have. We do not have a district psychiatrist. We do not have a district psychologist. So our package of care at our 9 community day centers, which is 8-hour facilities with the exception of Site B, which is a 24-hour center, and also Michael M, which has got a birthing facility on a 24-hour basis. You are lucky if it's open. Michael M has been closed several times in the last couple of months due to hijackings and crime. We've also got at Site B, we've got medical officers, radiographers, and dietitians that have been off for more than a couple of months because they've been repeatedly attacked or hijacked, etc., etc. Cape Mental Health, the driver the other day pleaded when they were hijacked on Baden-Powell for them, at least for the mentally challenged patients that was in the minibus with him, if they could be offloaded. And they were so kind to do that for him, and he could at least stand alongside the road and call for help while they drove off with the minibus, which is what they needed. And our concern is the mentally challenged child that was actually in the minibus. So that is our lived realities in Khayelitsha Eastern substructure. So our package of care is fairly fragmented. However, strategic partnerships. I'm wearing green because it is October, besides it being my birthday month and the month of my anniversary and my husband's birthday, it is also mental health month. And that is something that is very close to my heart. On a personal note, I lost a son. So that is why mental health is also very close to my heart. And I've got one of my other sons has some disabilities, and so mental health is something very, very close to my heart. You can move on to the next slide, please. So this is a picture that Paula sent me, and as I said there, this is about mental health is a strategic priority for the Department of Health, Western Cape Province. So this is basically what a group looks like. And all of them are sitting together with their peer coach, and they are basically now getting prepared for the session. So the waves are in the background. There's a soothing kind of atmosphere, and so it's a touch base. How are we all feeling before we go into the water? And when we go into the water, we hold each other's hand. And if one of us is not feeling okay, we speak up, and all of us as a whole, whoops, Nishan, will step back and we will not go into the water. Please do read up on surfing therapy. I'm not going to go very much into detail with that. So we spoke about the nuclear family and disintegration. At the conference that we spoke about paternal separation, about the absent father. And the statistics that was quoted is that in our societies, 60% of fathers are absent. And you can basically break that down into various categories. So in Khayelitsha Eastern substructure, we have a lot of single or child-headed households, and that in itself is a trauma. Then, if you're looking at where Waves to Change has set up, which is also in Houtpa and the Muizenberg communities, which services the greater Lavender Hill retreat area, every youth, every child has a sense or a need of belonging. They want to be seen, they want to be heard. So what do? They join the gangs. They drop out of school. They sell drugs because the merchant incentivizes them. They speak a particular language. So they get involved in at-risk behavior. And there is no father that is present to tell them that this is the wrong way or the path that you're embarking on is not the correct path. So these are the everyday realities, and what we are trying to do as the Department of Health and Wellness is early intervention. Next slide, please. So early intervention, why? Because it costs the Department of Education, the Department of Social Development and Health a lot less than having somebody admitted for 72 hours and then sent to a secondary hospital. But more importantly, when you can prevent something from happening to a youth, to an adolescent, the scars are less. So they have a better trajectory in life. So we often get referrals directly from school, or Waves to Change often gets referrals directly from schools or primary health care facilities. And then once the individuals has enrolled, and they from the ages of 9 onwards with Waves to Change, there's a year-long program, and then there's the Saturday classes that they can also attend. They remain within that system. There's also downward referrals once they've been admitted to the district hospital. Then they go back into the CBS, and CBS is a community-based service platform, and then back into Waves for Change. And something that Stella does in Khayelitsha Eastern, she monitors the revolving door admissions, those repeated admissions, because they are children that are particularly at risk, and we need to work with the Department of Social Development in collaboration to look at what we can do in terms of reducing their risk behaviors. Then we also look at social integration, and for this we use the whole of society approach. Basically what I'm trying to say is it takes a village to raise a child, and part of our village in Khayelitsha Eastern is Waves for Change. Thank you so much. Okay,
Keep the
sorry.
mic on fast there. We've got questions. We've got questions here for you. Guys, please type in the questions so that the speaker could answer that. Ask as many questions as you possibly can, so we keep it as long as we possibly can. There's a question that came up earlier before you came to the podium. It was, how do you take care of your well-being?
So I was just sharing with Gail earlier on that I've got leave coming up next week, and I've already put my out of office on because I've got some spa treatments planned, and my husband will be coming home. So that's how I take care of myself, spending some quality time with myself, because I've got to be in a good space myself before I can give. I can't pour from an empty cup. And then also with my significant others, I spend time.
So to Anonymous, put your Microsoft Outlook on. I'm out of office.
Yeah, out of office. Out of office.
How are kids referred to W4C? That's a question. Is it via social workers or community-based organizations?
So, like I said, we can. There's if a parent or an educator is concerned, they can do. The Department of Basic Education can do direct referrals to Waves for Change, or it can be via one of our primary healthcare facilities to Waves for Change. So it's an upward and downward referral. Therefore, the strategic partnership is important.
Thank you. And then what is a whole of society approach?
So WUSA is the whole of society approach. It means that all 11 departments in government puts the citizen at the center, so it's being citizen-centric and living out the values of the Western Cape government, which is accessibility, transparency, respect, integrity. So all of the departments come together, and for a particular geographical area like Khayelitsha Eastern at the moment, one of the things that all of the departments is focusing on is having safe corridors so that EMS and other officials can get to work, and also patients can get to certain emergency centers in a safe space. So it's just collaboration across the departments.
Good. Two more. You guys can stop now. You guys can stop now. But it's working well? Is it okay if the question is in your hand? How best can organizations not directly linked to Western Cape government or W4C get involved?
Cannot directly or directly?
How best can organizations not directly linked to the Western Cape government or the W4C get involved?
So basically, the Western Cape Government Department of Health and Wellness puts out external tenders every 3 years. So you can go on to Cape Gateway and basically look at that. But also on that portal, you can connect to any of the substructures, and per geographical area, there is a profile. So you are welcome to link with that particular substructure without specifically being within the Western Cape province.
Good. Then, is the Western Cape collecting data on the effects of toxic stress, broader mental health challenges on children aged 0 to 6? If so, where can this info be found?
Sorry, I'd need to defer that question to Stella.
We are, well, we'll keep this for you. One more for you, then we'll keep the others, because I mean, you're all in the same.
So can I just...
Could you answer that?
Yeah, can I just say that one of the strategic priorities for the department is mental health. You'll remember in the early 2000s, HIV was a priority for the department. So the indicators for HIV is very well developed. You know, viral load suppressed, you know, retention in care and those. We are only now working on refining the mental health indicators. So what we do have is admissions over 18, admissions under 18, and revolving door admissions. The other indicators are not very well developed, so that particular data that you are looking for would not be readily available unless there is somebody doing research, which Renee Nasson from Lentige Hospital is active. She's advocating for that, but it's not. It doesn't exist as yet.
Good. There are still many more questions for you, and we're going to stop because I see she's put herself now on her own well-being mode. She's off now. Thank you very much, Nashan, for just a round of a click of the fingers. I think that's the thing we do, eh? Thank you very much. Thank you. That was great interaction. Thank you very much to you all for taking part in doing the questions, and I see you guys really started to nail me there on the questions. Right, so keep them coming. We've got another speaker coming up which we can defer those questions to. Yes, we are. You did not put on your out of office. You are with us today. So the next beautiful lady that I'm bringing up is Dr. Stella Mokatimi. She's a mental health program coordinator at the Western Cape Department of Health, Khayelitsha Eastern Substructure. Doctor, do you want to get mic'd up there quickly by my gentleman there quickly? Powder your nose and everything for the camera. Hope everybody at your home and office is still okay. Please log in with us on the slido.com, and then hashtag the code is Waves for Change. And you could also ask a question at home, and also we invite you to do the polls and the surveys with us. So, Department of Health, Khayelitsha Eastern Cape Eastern Substructure. She holds a PhD in psychiatry from the University of Cape Town, and she has 23 years experience in the mental health, working in various platforms, adult, children, adolescents, at primary and tertiary level of care. She is a member of the Center for Autism and Research in Africa, that's CARA, and the South African Association of Child and Adolescent Psychiatry and Allied Professions. Her research in child and adolescents, mental health services and systems, her mission is to strengthen mental health services and systems, including CAMHSS in low-resource communities in collaboration with various stakeholders in the field and other relevant sectors. Ask as many questions as she presents, as she comes up, and I welcome to the podium Dr. Stella Mokitibi.
Thank you so much for that introduction. Look, I'm looking here now, checking for my laptop. There. Okay, I would like to greet everyone this afternoon and thank you so much for the invitation. It's such an honor to be invited to this event. I wish you had warned me because I would have dressed more properly. Okay, but we're here now. We have to, we have to survive. We're here. Okay, shall we put on the first slide? I'm just going to give you an overview of the current state of child and adolescent mental health services in our province and touch a little bit on the Khayelitsha Eastern substructure that we are actually servicing. And also just show you how it is linked to the community-based services as being offered by Waves for Change and why that collaboration is so important for these community-based services. I should look everywhere. All right, let's move to the next one. Okay, so when we see this figure, we will notice that child and adolescent mental health problems, they represent the greatest area of concern compared to all other health problems. As you can see there, between the ages 10 to 20, we see a rise in mental health problems. The yellow color there, compared to all other health problems. And you'll also notice that if they remain untreated, they will progress into adulthood and they result in complex adult mental health problems. This is why it is so important to treat them early, to detect them early and do something about it to prevent us having mentally ill adults with complex mental health problems. Let's move to the next one. So the data shows that 1 in 5 children and adolescents globally, they suffer from mental illness. And over 90% of children and adolescents are found in low and middle income countries. Yet the rate of unmet need is still over 90% in those low and middle income countries, including our country. All right. And in these countries, we find that child and adolescent mental health services are inadequate, as we know, as Nishan has also pointed out. We don't have enough resources to service this vulnerable population. The little services that we have, they are not responsive to the needs of the children and adolescents that we are servicing. And you'll notice that if you go to many of our facilities, and this is a global challenge actually, our children and adolescents, especially from the age of 13 to 19, they are mixed with adults. Now imagine your child being admitted in the same environment as a psychotic adult. Would you send your child to such a place? So those are the challenges that we are faced with. And this is why it is so crucial to look at how we strengthen child and adolescent mental health services in our context. So from 2015, this was my PhD study. We noted that data was lacking, current data was lacking. I think the last study was in 2010, which was conducted by Prof. Clenches, looking at the situational analysis of child and adolescent mental health services in 4 countries, including South Africa. I said, no. Now there's a need to strengthen child and adolescent mental health services. So for us to be able to do that, we need to first have the current view of the state of our services. And for anybody who's looking at strengthening any kind of a service, it is important to make sure that you look at all the aspects of the service. You don't just look at one aspect. So we developed this multi-level synthesis model that we used to understand child and adolescent mental health services in our context, and also for strengthening. We looked at the policy landscape. Do we have policies? We know that policies are very important. They inform resource allocation, financing, and everything. And if there are no policies, what guides the services? Do we have that in our country? We actually looked at the policy landscape at a national level. As we know, we do have the National Child and Adolescent Mental Health Policy that is meant to be a guide for the provinces to develop their own provincially relevant policies. But do those provinces have? And unfortunately, none of our countries have of our provinces. We also looked at the resource landscape, where we conducted a situational analysis of child and adolescent mental health services in our province now, looking at what resources do we have, and we went down to look at the stakeholder perspectives. What do people on the ground say and feel, and how do they experience the services? How do they want the services to look like? So we started with the senior stakeholders. Those are the policy makers, the senior management, the planners. What is their view of child and adolescent mental health services, and what are their recommendations for strengthening of the service? And then we went down to look at the grassroots level service providers. These are our mental health service providers in our facilities. And also we looked at the user perspectives of child and adolescent mental health services. We know we've got the Matupele. We cannot do anything without putting people at the center of the service, and it's important to understand what people want, what kind of a service, how are they receiving the service that we. So we looked at all those aspects that are out. You can check it out, you'll find it, situational analysis. What we found in our province was that about 10% of children and adolescents, the conservative estimates from the data that we collected in all our health facilities, 10% are suffering from mental health problems. And of that 10%, only 10% are actually receiving treatment from our facilities. And 1 in 10 of those children may receive intervention from a tertiary specialist facility with those long waiting lists. All right, let's move. So these are the published findings that are already out. You will find the policy paper there. You will find the SWOT analysis that looked at the strengths, weaknesses, opportunities, and threats to child and adolescent mental health services. The situational analysis is also already out, as well as the provider perspectives. We are now busy with the last paper, which hopefully should be out before the end of the year, to let you know what our users are thinking of the services that we are providing. So in summary, you will notice that overall, what we found was that there were more weaknesses and threats to the services that we provide for children and adolescents than the strengths. You can see the scale is tilted towards the threats and the weaknesses. And I would like to point out mainly the silo working of agencies. For as long as we work in silos, we will never be able to tackle the multifaceted challenges that are faced by our children and adolescents. Nishani has also pointed out how we should be working, collaboratively as all the departments, as all the NPOs and everybody, and make it our business to work together. The silo working is really a huge threat to the services that we provide. And also, I would like to also point out the limited capacity. Nishani has also pointed out the gaps that we have in the services that we provide. Our service providers, our resources are very limited. There is no capacity to deal with what is there and what needs to be serviced, and therefore we cannot do it alone. Okay, so coming to our substructure, Nishan has also already talked to these slides. This is the population estimates that we have in our Khayelitsha alone, Khayelitsha Eastern substructure. We're not talking about the Western or the Northern, just our substructure. And you will notice that the under 19s, there's a type error there. Ignore it. You will notice that about 397,294 are under the age of 19 in our substructure alone, not in the Western Cape. Let's move. And then of that percentage, 3% of the total population in our substructure, they present in our facilities and are treated for mental health problems. Okay, just in the Khayelitsha Eastern substructure. Of that population of the under 19s, 1,453 are presenting with mental health problems. And let me point out that you might say, it's just a small number. This data has got limitations, okay, because there are other services that are not yet capturing the data. So our information systems also still need to be improved such that it captures everybody everywhere where there are services. So this is still limited to the mental health, more of the mental health specialist services. We're not talking about pediatricians who are servicing the children. We're not necessarily including if CBS is there or the school health services. So there are more children actually that are presenting out there than the number that is actually reflected here. Okay, and just an overview, these are the problems that we deal with our children. These are found from adults and children and adolescents. Our children are presenting with psychotic disorders, substance use, which is the main problem, unipolar disorders, bipolar, anxiety, a lot of them ADHD, even though we may even say that perhaps we're even overdiagnosing ADHD. A lot of those learners, they are diagnosed with ADHD, specific learning difficulties, oppositional defiance disorders. Yeah, and as we know, mental health problems never really come alone. They always partner with something else. So hypertension, HIV, epilepsy, and diabetes are some of the comorbid mainly, and also understanding the context. Let's go to the next slide. Based also on the context that they live in, that is characterized by low socioeconomic conditions, including poverty, high rates of crime, and substance abuse. That creates a revolving door syndrome in a lot of our district hospitals, and violence and exposure to violence, which leads to trauma, and then these children collapse. So the mental health service platform in the West, in our province, and including our substructure, is guided by the our mental health policy and strategic plan, which actually states that mental health services should be provided at all levels of care. So it basically explains the continuums of care for mental health services, including children and adolescents. And so there's no level of care that should not have a mental health service provided. Let's move. Just to outline what we have in the Khayelitsha Eastern substructure, I'm not really going to read the name. Perhaps we can start. Let me start on top. Those are our tertiary hospitals. That's the tertiary level. We have got our specialist mental health hospitals as listed there. And those deal with the complex problems that cannot be managed at community level and even at district level. And most of them, they require long-term interventions. We've got them for children as well as for adults. At district level, we've got our district hospitals. In Khayelitsha Eastern Substructure, we've got 3 district hospitals, Yester River, Khayelitsha, and Helderberg hospitals. Those are meant to provide only a 72-hour observation. After 72 hours, the doctors are supposed to determine whether you're discharged or you are fit for discharge or you need a long-term intervention of which you would be escalated to tertiary level. I'm saying they are meant because that doesn't happen. It's on paper. A lot of them, they require more than 72-hour observations, but they still remain in our district hospitals and overflood there because there's no space at tertiary and they cannot go back to primary level. And that is exactly where you will find our children mixed with adolescents and mixed with adults in those spaces. But as Nishan has said, we have managed so far to create a 3-bedded unit at one of our district hospitals in Khayelitsha, just to move those adolescents away from the adults to prevent that exposure that will re-traumatize them. But we don't have that luxury in all our district hospitals due to limited resources. It's something that we're also working on. At primary health care, we've got 9 clinics in our substructure where you will find the medical officers, family physicians, pediatricians that also service our children with mental health problems and mainly ADHD. And if it's something beyond that, that is more complicated, you will find our mental health nurses there and psychiatric registrars, psychologists and counselors that see and intervene in those problems. Quite nicely now, we have managed to secure at least 1 day in each of our clinics whereby children are seen away from adults. Okay, if you go to other substructures, don't ask why, you will find that children are still seen in the same spaces as adults, but we've tried in our substructure that under 19s must be seen away from the adults on a separate day. So if you want to refer your child, the nurse will tell you, come on this specific day. Okay, we are working very soon. We're going to be providing all our facilities with child-friendly resources, assessment resources, because when you engage with children, you need to use appropriate resources to elicit, you know, their feelings and their experiences and everything. Okay, and at community-based level, we have got huge gaps still there. We've got residential and residential facilities and daycare facilities. And for now, those are mainly for intellectually disabled. All right. We have got a gap for those who are not intellectually disabled at community level. This is exactly why. While we have community health workers that are doing home visits to service mental health problems, they are not yet doing that for the under 19s. We are still doing, developing it because they need to be trained to know how to engage with children and adolescents. All right, let's move. And just lastly, on the previous slide, we have managed to recently collaborate with other sectors that are dealing with children and adolescents. DSD, our partners are here, Department of Education are here, and we tackle all those cases that are presenting with complex problems that require intervention from other sectors, and we make sure that each child is serviced. So these are the gaps mainly I'm going to mention at community-based. Click again. Yes, I'm going to just point out mainly at community-based services platform, what the gaps are. At community-based platform, we noted that we, in terms of prevention and dysregulation, in order to mitigate all the negative impact of the social determinants of health for children and adolescents. Our CHWs, community healthcare workers, are not yet trained to deal with children and adolescents with mental health problems. As I've said, there's lack of capacity for skilled specialists. We've got only so much. In some facilities, find one mental health nurse with huge caseload and does not have the capacity to go down to the community and offer those services. So, and there are a few unfunded NPOs that are trying, but the gap is still huge. All right, let's move. These are our three, click again, these are our three main priorities for mental health in our substructure. You might find that it's different in other substructure. The red one, I'm emphasizing on the community response to mental health. It's one of our key priorities. And I think that is what brings us here. Next. And the community-based child and adolescent mental health services are needed so much to bridge the gap that I've already outlined there. We need community-based organizations that will focus on promotion and prevention for child and adolescent mental health, that will ensure that there's continuity of care post-discharge. Some patients are discharged. What happens to them? They fall through the cracks, okay? They're going back to the same environment. We need organizations that will collaborate with families, with the Department of Health, Education, and Social Development, those departments that deal with children and adolescents. Organizations that will work collaboratively with us. Organizations that will break the cultural barriers. As we know, Khayelitsha Eastern Sub have mental illness, there's still stigma. Okay, we need organizations that will break through those cultural barriers and provide separate services away from the adults to prevent the exposure. And when we've had that, our children, they will be able to self-regulate. The emotional regulation will improve. The self-esteem should be improving. The sense of identity in this identity crisis stage will improve. Self-control, family relationships, as well as access to care, because then you will be referring those cases that you cannot manage. The nurses, the service providers can still refer to the community-based services. Next one, I think it's the second last one. All right, I'm done.
Thank you, thank you. Dr. Stella, just for the sake of time, we're running out of time. I hope you guys are all still okay. There is a myriad of questions that is pumped in for you, a myriad of questions. Guys, the memory of the software can't even handle it. That's why the questions have come through here. I'm just going to take two very important questions. Then we'll share the link with Doctor, and then Doctor can then respond to you personally. If that's okay with everybody? Yes. Have a deal with the numerous safety and resource challenges. Who takes care of the carers?
Yeah, who takes care? I think these two questions is two in one, actually. As I've said, they don't have capacity to answer the first part of the question. Sure. The second part is, yes, we have made provision to take care of the carers. All our mental health nurses, for an example, we acknowledge that they deal with complex problems and they are overwhelmed with huge caseloads. They can easily, experience burnout. So on once a month, they do meet with the psychologist, okay, where they are provided with a space, to share their experiences and to debrief, and so that they are mentally well.
Good. And the final one, which is a very important one I wanted to ask you out of the hundreds of questions. Oh, yes. How is substance abuse linked to mental illness?
Oh. Yeah, I think in simplest terms, we know substances lead to psychosis. Okay, and psychosis is one of the features of mental illness. I mean, it can be a study on its own. The various substances that we use, they're all going to lead you to one place.
Okay.
That is psychosis.
Thank you. And then just to end off, someone didn't ask a question. Someone just, it's from ES. It just says, smart Dr. Stella.
Thank you.
Thank you very much. You can go up there that side. Thank you. Thank you, ladies and gentlemen, and thank you for you guys. There is people that's asking questions, not in the room, but outside of the room as well, so that's good on the engagement. We're going to go quick. I'd like to bring up to the podium our main speaker, which is the Director of Monitoring, Evaluation, Research and Learning. And Nikki holds, Nikki's been with the organization, I think, for the last 5 years, I think. And she holds a master's degree in program evaluation at the University of Cape Town and a master's degree in criminology. She has 10 years quantitative and qualitative research experience in the development sector, including program monitoring, evaluation and learning experience. Her criminology and psychology background, coupled with her work experience, have refined her passion for an understanding of the necessary requirements when working with children and youth from very volatile backgrounds and their specialized needs. She is driven to contribute to furthering development initiatives, ensuring that they are adequately designed, effectively planned and executed, and thoroughly evaluated, contributing to the successful achievement of the envisaged impact. She believes that this is critical when duplicating similar initiatives based on the "so what" question and supported by sound empirical research, which she believes cannot be done without understanding and recognizing young people's challenges, needs, their behavior, their dreams and desires, and overcoming their worst fears. Nikki's an avid runner. She's a surfer. She's an all-round sports fan, and I hope next time we can all come dressed as Nikki to the conference, and I'll put on my board shorts. Subsequently understands the role and the value and the power of sport and physical activity in promoting, achieving and maintaining a healthy mental state. Before you come stand next to me quickly. I wonder if we can just pull up that quick survey. There's a survey coming up and it's pertaining to the topic and what the main speaker is going to be speaking about. We're calling it the Nikki Pre-Survey. We actually called the survey after her name. Isn't that wonderful? So there's a survey coming up. I would like us all to quickly engage on that survey. That survey is very important for the speaker to understand who is in the room and what the room thinks about the survey or the poll that you might be engaging on. So let us quickly go and do that live poll quickly. Yep, I'm in my polls. There we go. So that poll, seeing that it's Nikki's poll, let's just see. The first one is, what is your understanding on the mental health treatment gap in South Africa? We got thinkers in the room, yeah? What is your understanding on the mental health treatment gap in South Africa? It's so nice to see everybody's engaging. It's awesome. There's a few people here that didn't bring their cell phones with, but it's fine. It's also a good thing. All right. What is your understanding on the mental health? There's 18 people engaging on this poll only. Is this the results it's showing here, Ethan? Okay. 18 people, 20, and the numbers going up. Okay, I'm going to move on to the next one because you can still keep engaging on it, and I see all the others are being engaged. So that's good. It's all equal numbers. The next one is, how accessible do you think mental health services are in your community for children and youth? And then we'll keep that last one for later. And then, from which organization or department are you from? And lots of people have voted in on that one. Okay, so there we go. Everything's there for you to see. So we can see here is this graph. How accessible do you think mental health services are in your community for children and youth? So you can click one and we should see a result. Is everybody clicking the send button? Good. Next poll. From which organizing department are you from? Yep, it's live. Okay, can I leave Nikki with all the stats and everything here? Okay. No results. Not showing. Okay, let's just, for the sake of time, I'll come fix that now. But that's not the system failing. I think it's the people failing. Thank you, ladies and gentlemen. Nikki.
Thank you so much. At Ways for Change, we snap clap. Thank you so much. Thank you, Stella and Nishon. Those were two really good introductions. I'm trying to find Stella. Here we go. Nishon, I know I had to go. Thank you so much. You did a lot of my presentation for me, which is, is a good thing. So just introductory to Ways for Change, we use the rush and the fun and the excitement of surfing, and we combine it with mind-body therapy and provide what we believe a community-based, child-led, youth-friendly mental health service, especially in priority communities where children don't have access to these kinds of services. We were founded in 2011 by Apish, sitting in the back, you'll meet him a bit later, and Tim sitting around the corner, both also two really good surfers, and they saw the value in surfing, combining that with a safe space for children. We service at the moment over 40 priority communities across 2 provinces, the Western Cape and the Eastern Cape. We've got 5 sites reaching over in excess of 2,000 children on an annual basis, children aged 10 to 16 that come to our service. And the service delivered by local community coaches. We employ about 45 community coaches aged 18 to 25 every year. And they're from the same communities where the children are that we've got in our service. Next slide, please. It's just a short video.
Wave. Wave. That wave. That wave. On that wave. You on that wave. You on that wave. Can be on that wave. I can be on that wave. Dreams I can be on that wave. Dreams I can be on that wave. Dreams I can be on that wave. My dreams I can be on that wave. My dreams I can be on that wave. Still my dreams I can be on that wave. Still my dreams I can be on that wave. At least in my dreams I can be on that wave. I can be on that wave.
Thank you. Next slide. So Stella and Nishan has both spoken quite a bit about the problem, so I won't spend a lot of time here, but what we do know, the children that's referred to our service face chronic adversity, and it's things like seeing stabbing, shootings, loss of a parent, neglect, abuse, and it doesn't happen just once or twice, it happens chronically every day in their lives. And that causes a toxic stress response, and someone asked earlier about the toxic stress, and we're not experts in that, but we've worked with some experts in the field and academics, and we do know that toxic stress changes a very important part of children's brains, the amygdala, and specifically where important functions like decision-making, memory, making positive choices happen. And then if there's negative self-regulation, there's a negative effect on children's functioning. So what does it mean for a child in their everyday lives? It means they can't make good choices, they can't form healthy relationships, they can't concentrate in school, they get involved with antisocial behavior like substance abuse. And then there's, of course, then Stella spoke a lot about the impact on the mental health system. If there's lots of children developing all these kinds of challenges, the mental health system has got is overburdened, and less than 1 in 10 children gets the mental health service that they need. Next slide, please. So in the latest South African Child Gauge that was highlighted, and we found this quite a profound opening statement in one of the articles, and it said, child and adolescent mental health services are in crisis. Let us not be found wanting again. And we know Stella spoke a lot about and mental health professionals that can help fill that gap. We know a lot of those services are offered in urban centres. They're often not age and culturally appropriate. They're often not where children have fun. They're often in a space where children doesn't feel comfortable to talk about what's going on for them. And so we know at Ways for Change the response need to be extended beyond dedicated professionals, but that they themselves can't do it by themselves. Thank you. So at Ways for Change, we, like I said, believe that the view we're looking at environments where children can thrive needs to be broadened. It can't be only in those clinical spaces. We do know, we've learned over the past 11 years that caring community coaches can provide a fun, safe, engaging space where children can learn those skills. And for us at Waves for Change, when we combine those caring coaches with the healing power of the ocean and with the nature, children we can prevent them from developing more serious mental health challenges. Thank you. So for us, the solution and what we want to, some of you may have heard some of this, but what we want to introduce today is Waves for Change surf therapy, and it's underpinned by our 5-pillar method, and I'll go into the 5 pillars now. Our model was designed through a PhD study and child-led research and evaluation projects, and we've been working over the past couple of years with universities like University of Cape Town, University of Western Cape, the New School for Social Research in New York, and Edinburgh Napier University in Scotland. And we've tried, you can go back, sorry. And we've, through the years with all the works with the academics and experts, we've tried and tested and refined, and what we believe now have got 5 active and really key ingredients in a community-based, youth-friendly mental health service. It's delivered by community coaches who come from the same communities. We've got, as someone asked earlier about referral pathways, so we've got a community-based referral pathway. It's a simple and swift referral pathway in and out of our service. We also train some of our referral partners how to identify children with mental health challenges, for which children is the service appropriate, for which children not. We've got referrals from local schools, and that's schools for both neurotypical and neurodiverse children. We get referrals from other government departments like social development, from Department of Health, so local clinics and hospitals. And then once children are referred, they come for 10 months, once a week for a 2-hour surf therapy session. We provide food, safe transport to and from the beach, and then our coaches get weekly training, supervision, mentoring, and the service runs at a 1-to-7 coach-to-child ratio to make sure the service is run safe and that coaches can also hold a safe space. Thank you. So this is how we see change happening for the child, so the solution at a child level. I won't go into all of this. It's all in we're actually launching today a learning brief, and it is in the learning brief, so you can read it. But what I do want to highlight is pillar 1, so the caring coach. The caring coach sits really at the heart of our service. The caring coach is where we spend a lot of our effort to make sure that they are equipped to deliver community-based service. And with ongoing support and mentoring, they can create pillar 2, which is the physical and emotional safe space. Coaches hold that space. And we know when children experience just that pillar 2, they experience respite. So respite from negative thoughts, negative emotions. They're also connected to positive peers, positive peer support. So in that first pillar, they make friends with coaches, they make friends with positive people, they start to trust those around them, they start to be able to share how they are feeling. So it's really a space where they start to build relationships that they trust. And then if that space created, our caring coaches are trained to facilitate pillars.
1 sec.
I will give you 1 sec. Who asked for that? And then caring coaches can facilitate pillars 3, 4, and 5. Pillar 3, for us it's surfing. In our model, it can be a challenging new task. So it can be any challenging new task. It's surfing at Waves for Change, and in a trauma-informed way. So not in a toxic, competitive way, but in a trauma-informed way, and in a way where there's an experience of mastery. Pillar 4 is our curriculum. So it's evidence-based games and activities that's underwritten as opportunities. So when children's gone through the 10-month program, we've got an aftercare program, but we also have a referral network where we can refer them to for other opportunities. And in that part of our service, children really experience, that's delivered in a mastery climate, so where children can feel a sense of achievement, and it's also where they develop self-efficacy. Yeah, so I won't go into the rest. I think you can, our learning brief will be available. So this is the solution at a mental health system. So it's slightly more zoomed out, and where we see our service can be effective in a lot of the challenges that Stella and Nishan spoke about. I think it was Prof. Crick that wrote recently, that you might know, that our mental health system, South African mental health system, is very reactive. So it focuses resources and it focuses initiatives on more serious conditions, more serious when challenges already occurred in people, and it should be more preventative and in early intervention work. And that's really where Ways for Change feels our work can close the treatment gap and can really make a big difference. If we've got these cohorts of community coaches who's been trained to deliver mental health promotion service, to catch children early, to help them not move further up in this pyramid, we can relieve a lot of the burden higher up in the pyramid, and they can task shift this promotion and early intervention work to help children. And on the middle level, how we can help, so even our service sits here at the bottom, at the middle, we know that we help children if they're identified to address that toxic stress response. We help them not develop further mental health challenges. Children that do need clinical interventions, if we catch them here, we can refer them earlier. So if there's promotion and early intervention looking out for those children, they can refer them earlier up in the pyramid. And then also less children needing expensive treatment or becoming ill. At the top part where we help relieve the burden, Stella spoke about, I think both Stella and Nishan spoke about the revolving door. And if a child is in a trauma unit because they've been a survivor of violence, our service can help run parallel to that service, a clinical service, or as an aftercare, so that a child's got immediate access to community-based support, and it helps them returning, going back to the top of the pyramid. Thank you. And then I want to introduce a big part of our learning brief that we're launching today and of today was just to share with you our most recent research study and external evaluation we did with a new school in New York. It's titled The Impact of Surf Therapy on Risk-Taking and Interpersonal Closeness Among Violence-Exposed Youth. And it's at the moment for peer review in the Global Journal for Community Psychology Practice. So as soon as it's published, which we hope is relatively soon, we'll also share that. So I won't spend a lot of time on the design. Everything is in the learning brief, but maybe just to mention, it was a multi-method evaluation. So we used both self-reported data from our children, where they fill in surveys, but we also know it's got quite a lot of limitations, language limitations, literacy limitations, where the children give answers that they think you want to hear. So we paired it up with behavioral measures. So there's our games that children played on tablets. They thought they're playing games. We knew we're collecting data from them, and it was quite interesting how some of the findings correlated with the self-report or completely didn't correlate. So part of the study was to look at which tools resonated with children and which ones not. The 5 things we looked at in this study was exposure to violence. So we did want to understand how frequently children were exposed to violence. We looked at their sensation seeking, stress, self-esteem, interpersonal closeness, and risk-taking. And then 233 children participated in this study over 6 months. We also approached the study from a community-based approach where we trained our coaches to collect the data. And I think we found it's always tricky to know who must collect the data, but the children we work with, because they've got such a good relationship with coaches, it seemed that it was a more trusting environment, that they were more open to answer questions, and it wasn't someone that couldn't speak their language, they've never met before, that collected the data. Yeah, so that's just a bit of background on the design. Thank you. And then the 3 key findings from the study was, firstly, significant reductions in impulsivity. And you might ask, what does that matter for a child? But literature and research shows that impulsivity is also strongly correlated with the inability to recognize and deal with emotions, inability to stop and think before you act, to stop and think about your future choices, better choices. It's also positively associated with anxiety, developing anxiety and depression. So we know if children's got significant reductions in impulsivity, they can better self-regulate, they're more likely not to develop more serious mental health challenges. Then we also saw significant reductions in high-risk-taking behaviors and sensation-seeking. And what was interesting about this finding is the tool that we used looked at both maladaptive risk-taking and sensation-seeking, for example, dangerous behaviors or breaking rules and laws, but also adaptive sensation-seeking and risk-taking, because we want to introduce children to a task that's challenging and new. We want some children to go into the water that's scared of the water. So if there's not some risk-taking, if there's no risk-taking, it's maybe also not a good thing. And what was interesting in the study is that after 6 months or longer in the program, children were less interested in taking risks or sensations that were maladaptive and more interested in taking risks that were adaptive, for example, doing things that made them feel brave and doing things that gave them a sense of mastery. And then the last one, increased sense of interpersonal closeness and social connectedness. So it's one of the, I think, key aims of our program is to make sure children who come to our service experience a sense of belonging. We've got a bananas culture that stands, this is the sign when children come to our program and everyone goes bananas when they see coaches or anyone with a Waves for Change t-shirt, and it stands for protect, respect and communicate. But just that very first couple of sessions where they feel part of that session, you can see that they feel a sense of belonging to something. And the study also subsequently found that we improve children's social connectedness. And again, lots of research shows that when someone feels connected to something or someone, I think you spoke about wanting to feel connected to a father figure or just some form of attachment. And we know a lot of the children we work with do not have attachment. They've got attachment challenges. So children who come to our service experience social connectedness, again, less likely to develop mental health challenges, more likely to be surrounded by protective factors. Thank you. And then just 2 study implications we've pulled out. So we were like, what does that mean? The one is we wanted to highlight, we know that caring community coaches are at the heart and they're a core ingredient. And we know there's lots of caring community coaches in the communities where we work. It's not only ours. There's lots of physical sports-based activities going. So if we know that caring community coaches is a key driver of outcomes in a community-based mental health service, there's a big resource we can tap into. And then also that it was an effective trauma-informed intervention for violence-exposed youth. And we've spoken about how much violence children face in the communities where we work. And if this is a good alternative, it's got an implication for the treatment gap. And then just a little bit about what's next. We in Waves for Change is in our next strategic phase for the next 5 years. Very exciting for us. And what is exciting is the sharing and scaling of our 5-pillar method. Like I just mentioned, we know there are lots of community coaches already delivering community-based sport or physical activity services. And if our 5-pillar method can help pivot some of those services into a mental health, helping just creating some of the spaces to be safe, some of the spaces to be trauma-informed, then we can build this part of the triangle even stronger. We can't do it alone, the mental health system can't do it alone, and there's so many organizations that we can help that already deliver some of the pillars, the fun, challenging tasks, that already has some of the coaches. Then we can strengthen the bottom of the pyramid to make sure that the burden on the top part of the pyramid is relieved. And the other exciting opportunity, you mentioned it, was if this part of the pillar is stronger and more young people in the communities are aware that mental health is not only mental health challenges, but it's also promotion, it's also early intervention. The stigma is quite often to think about mental health as just the serious conditions. That's why we don't want to talk about it. But we all have mental health. And if there's young people that can speak about mental health from a protective point of view, from a point of view as we need to intervene earlier before these symptoms get worse, then less children, less adolescents, less young people have to move up to that part of the pyramid, which is how we feel we can now close the mental health treatment gap in South Africa. And then I'll just end off, that is me, but I'm just going to end off with a video. Yeah, thank you.
The infrastructure in my community is very bad. Most people live in shacks. There is poor access to clean running water. Kids are introduced into gangs at a young age of 11. There's a lot of gang violence like shooting, drugs. and there's a lot of violence against women and children. Parents are often unemployed, meaning there's no income in the household, and a lot of children drop out of
There's
school.
results of that survey. I'm going to read it out.
My name is Annalisa Mhloli. I am a 25-year-old. I am a senior Ways for Change coach and a mentor to children in my community where over 1 million people live. My community is very overcrowded. I have grown up surrounded by violence and faced adversity myself. I know the impact that this has on children when they are growing up here. Access to mental health services is very low in Khayelitsha. At Ways for Change, we work with teachers, social workers, and community members to tackle stigma. We talk about the impact of stress and trauma on the way we behave and learn. I am very passionate about changing attitudes in my community, as most people still think mental health is about being cursed or bewitched. There is not even a word for depression in my language. This community referral network I helped build, then use the indicators we share to refer children most in need of support. Most referrals come from schools in the most underserved areas. We work with children who have experienced repeated trauma like rape, domestic violence, and drugs like tech being used at home. These children are referred by local hospitals, clinics, and social workers. We pick children up from school or other pickup spots in the community. When they get to the Ways for Change site, they are very excited to be at the beach and see their coaches. Our Ways for Change culture is inspired by Ubuntu: protect, respect, and communicate. We sing and dance a lot, bringing fun and energy to every session. We like to celebrate that side of our culture together. Children from my community are looking for a sense of belonging, a tribe for them to be part of. Activities like surfing are difficult, but allow everyone to take part at their own level. Learning to surf for me was like mastering a new skill that I did not think I was going to be able to do. When I started at Ways for Change, I couldn't even swim, and the ocean really scared me. When I'm in the water or on the board, I tend to focus on the paddling, the staying in the right position on the board, but I fall off all the time. Falling off the board is part of the fun, because if you don't fall off, you'll think you're a perfectionist, and I believe there's no such thing as perfection. I see the waves like the challenges in my community. These challenges will either eat you up and spit you out, or you will learn to ride them. At Ways for Change, we just use surfing as a hook to give children a safe space and safe adults. We share activities like Take 5 and the Power Hand. These help them to self-soothe, gain control of strong feelings, and think before they act. They can use these tools at home and at school, but they first practice them at the beach. Surfing helps children to regulate their emotions. It gives them another option from joining a gang and helps them to feel better about themselves. Hardly anyone I know has health insurance. Stigma makes it less likely for families to attend mental appointments at the hospital or clinics. At Ways for Change, as coaches, we have our own debrief psychologists that help support us in delivering surf therapy and meeting children's needs. Ways for Change coaches represent diversity in their culture, their language, and their gender. We give children access to support that they need in a fun, child-friendly way that's close to their community. I hope more young people like myself can be supported in delivering an essential child-friendly program for mental health support for children across South Africa and beyond.
Thank you, Nikki. just very, very, very briefly, thank you very much. It was a beautiful, wasn't it good? Very informative and good work that Waves for Change are doing. Another round of applause. Click and clap. The survey before this was, what's your understanding on the mental health treatment gap in South Africa? The largest thing that came through was resources, which was quite interesting. And the second poll question was, from which organization department are you from? And we see in the room is W4C people more than anybody else. Ways for Change. Mostly in the room. The others are all these small, itsy-bitsy beanie, United Global Mental Health, Norton Rose attorneys. It's very small in the background there, but you are individuals that came out to support. The word cloud says it all. That's all who is in the room at the moment, okay? Thank you for voting. The final one is, how accessible do you think mental health services are in your community for children and youth? Nikki, that's quite interesting, eh? It says not accessible at all. You know, that's a 25 point system there, and accessible is 5, which is low, somewhat accessible, never very accessible. Yeah, so there's a lot of, that says a lot, that says a lot. And then the 5-pillar, we're going to call up the 5-pillar survey quickly, if it's okay with you. We can liven that one up. That's the final one that we'll do for Nikki. And then I've got prizes to give away while you guys are doing that, okay? And I'm going to give, while you guys are doing that, engage, don't worry, engage. There's some prizes to be given away. I would like to give somebody in the room something. And you know what the prizes are. It's this beautiful, For the Love, a South African surf journal. Beautiful, beautiful book to have. And I'm going to give it, is Jaco in the room? Waar is Jaco? Is Jaco hier? Jaco, the book is yours. Come and grab it, man. Do you know why I gave it to you, Jaco? You're one of very few that actually typed their name into Slido. The others are all anonymous, but they're sitting right in front of me. Thank you, Jaco, for engaging. And then there is another person I'd like to give. It is Kane Matloko. Are you here? Whoa, conspiracy. There is a prize conspiracy. Thank you for engaging. Thank you for engaging. How's that poll doing there, guys? Okay, there we see. Do you see the 5-pillar method as a feasible intervention to close the mental health treatment gap in South Africa? Well, out of the 41 people that is actively voting, 42 now, 38 is saying yes. 4 is saying maybe. 0 is saying no. So that's what we could draw out of the room. That's about 80% of the room that's voting at the moment, because you're about 70 odd people in the room. I would like to give another book away. I want to keep one for myself, so I'll only give the other 2 away. Gail, is that allowed? We foul play in the competitions. I'd like to ask you a question, and this is an anonymous question, but anonymous will come forward and collect a prize if I'm reading the question. How's that? Let's give a prize for the anonymous as well. Okay, not those scammers sitting there in the corner. Does Waves of Change give swimming lessons before surfing, or do you learn how to swim while surfing? Before you answer, who the hell asked that question? You can come and collect the book. Thank you very much. That is a very, very good question, because I also wondered that. Can you answer that question?
I want to put one of my training team colleagues on the spot, but I won't. So no, it's fine. I'm joking. We do not teach, you asked, hey, we do not teach children how to surf, but how to swim, but the service runs for probably about 4 weeks, 6 weeks before children get on surfboards. So the very first lessons are about water safety, pair floating. They learn how to float first, they learn how to blow bubbles, then they do pair surfing. And for most of them in the first 10 months that they're in the service, go knee deep into the water. And that's why we've also got the child to coach ratio to make sure that children are safe. So while we don't teach them how to swim, they do water safety at some of the tidal pools. They do learn how to protect themselves. They learn about the tide, how to read the ocean with their coaches. And most of them are at a level in the water where they are still not deep enough on the back line. Yeah, that answers your question.
That is a prize well deserved for a question of that caliber. So, any chance of work of W4C looking at having adults as clients in the future? The person who asked that question deserves a prize. Where is thou? There is it. We've got your question here.
Because I want to be a client.
Can you answer that final question for us there quickly, Nikki? Thank you. Anonymous, thank you, Anonymous. Thank you, Anonymous.
I think the first thing, and I'll rely on again on some of my colleagues, I think the first thing what makes our model really, really strong is that we intervene at a stage where we feel a child's brain is still developing, at a stage where it's almost at a crossroad for mental health service, whether we can help with promotional early intervention or developing more serious challenges. So the service is specifically designed for that age and at that age to intervene. The other thing is because our service is delivered by community coaches ages 18 to 25, might be quite challenging to have someone that's 30, 35 that needs to be mentored and a space be held where they're much older than them. So the model is designed, and that's why it was also designed with children who helped us put their service together, because it really speaks to children's needs at age 10 to 16. So probably not. We can do a private lesson. We do have a lot of coaches to do private lessons, so that we can do.
I hope that the department that is here today can also maybe go for a surf lesson or two, maybe on a sunny day. We should invite them all out to come and have a look, see what you guys are doing in the salt water. You've been there before. Okay, so I'm gonna. Thank you, Nikki. You can leave the stage now. I think we've done all your surveys and your quickies, no?
I just also want to say, I wanted to say it when I started, and I forgot. Happy Global Mental Health Day for everyone on Monday.
Here we go.
Thank you.
Thank you. All right. So I'm going to give one more prize away, but not just now. I just need to conclude. I would just like to. There is obviously one or two things that's happening. Vote of thanks. From some special people that's in the room, but thanks again for engaging and doing the technology route of clicking onto your phones. Didn't it work better this time? Yeah, much better, ne? Yeah, there we go. They see the prize givers are clapping more better than everyone else. So, okay, I would just like to I think this is going to be sort of our outro today. I think it's going to be very special that we can conclude the day. I mean, it didn't feel like a mental healthness thing. It felt like we were knowledged up today. I think we came to find information, and that was what this was about, and that you could also raise anonymously your questions. And it also shows that we are fair here, that we are also caring for the anonymous people and for those with names and surnames. All right, so I just want to call up, but first let me introduce the following person that will come to the podium. It's the CEO and founder of Waves for Change. That's Tim Conway. He's the founder of the W4C. Geez, I wondered what W4C stood for, and then I learned it as I was continuing today. Waves for Change and prevention and promotion programs that use sport. Before I bring this lovely gentleman up, we also rate the speakers and we rate the topics in the surveys. Those are things we do not put on the screen. It might offend some of the speakers if they get no stars or some stars at all. That's privately for the analytics for Waves for Change to see if it was relevant. So we do some feedback on that as well. And we're also going to rate you. I will rate you, the audience. Please welcome to the podium CEO and founder of Waves for Change, Tim Conway. Keep clapping while he comes to the podium.
Thank you. Thank you for calling me lovely. I'm going to keep that one for future ego boosts. Thank you guys. Well, thank you for everyone for coming and giving us your afternoon. Yeah, we really appreciate you making the effort to come down and hear a little bit about the research we've been doing. So thank you. Some special thank yous to Nishan, who I think has gone on to her next event, and also to Stella. Yeah, it means a lot to have you with us and sharing your knowledge and endorsing the program and being with us. So thank you very much for your time. Nikki, where's Nix? Thank you for the presentation. You and Lee especially have worked really hard to get all that data in. Managing the relationships with all the universities is not easy, and you've done it really well, and we've got some amazing evidence from it. So actually, just on behalf of everyone, I just want to give Nix some snaps. Thank you. Tanya and Gail, thank you very much for putting today on. Yeah, we've not been able to do these until you guys joined us. So Tanya, especially, thank you so much for all the effort. It's been a lot to do, and we really appreciate you. Thank you. Yeah, and then just a couple of words, I guess. I suppose Apish is going to close us out, but I know when Apish and I started Waves to Change, what feels like lifetimes ago, we wanted to just do some simple things, really. We want to start some kind of program that kids wanted to be part of. And they do, if you've ever been down to Muizenberg or Monwabisi or the Orient Beach in East London and you hear the kids in the water and you hear the noise, there's a program that kids really want to be in. At the beginning of Nikki's presentation with Msingati, he's now a coach at the Monwabisi program. It's a program that really keeps kids coming back, and the more, the more kids come back, and the more we do is create these kind of really fun, sticky mental health programs, and we've managed to do that. We also wanted to do something that could, in our own little way, we are surfers, but we want to, address some of the social injustices that have happened, not just in South Africa, but internationally. Surfing's not a sport for everyone; it still isn't. But in our own little way, we're starting to change that. And I love that the people at the forefront of that movement are the coaches. It's really important for us, and we're very proud of the coaches. So yeah, that's been really important for all of us to see. And then the last thing is really the evidence. We've and a lot of the people in the room have supported us to get there, worked for us, funded us in the past, to get this evidence that surfing, cycling, rugby, all these sports, they can play and they should play a big part in our society. And that if we can get those, if we can get the evidence right, and we can start getting the links between the departments of health and education and the NGOs like ourselves, we can relieve a bit of the stress burden. So that's where we've got to. And for everyone, everyone in the team as well who's walked this journey, it's 10 years of really hard work, and I kind of feel like we've got there. So I just want to say thank you to everyone as well in the team. And where we're going next is, we want to set Waves for Change up to last. So we've been around for 10 years, 11 years. I think I was 28 when we started it, and I'm now over 40, which is terrifying. But we want it to be here when some of us aren't around. And a big part of that is partnerships. So for the people who came down, especially from the departments, we really want to start working with you. We've got the referrals going, but let's open up those conversations and see what we can do together. We've got the evidence, we know what we're doing, so I think you can trust us, and it would be really lovely to continue some of the conversations we're having. Yeah, and just, again, thank you all for making the effort that we'll do some more of these. Yeah, we have Tanya and we have Gail who are, getting these together, so yeah, really looking forward to continuing the conversations. Thank you very much. And where's Apish? Much more eloquent and good looking.
While we're still looking for Apish, there's Apish. Have your water, Apish. I'll bring you up in style. Just calm down. I'll bring you up in style. Hold on. I'll bring you up in style. Okay, so quick one. We've got a current poll that's open up. This is a very important poll before Apish comes up, because I think Apish is going to set the tone for the following poll. He's got a jacket on the same color as my ribbon, guys. Come on now. So the question here is, how would you and your organization like to get involved? That's the question. There are multiple choices there: individual giving, corporate giving, in-kind support. I love the in-kind support. Already people are voting. My word, Gail, this went faster than what we thought it would. Corporate giving, all sorts of other giving. Sponsorship. On top of your poll, you'll see Gail's information is on the top, her email, her cell phone number. Jot that down quickly so that when we leave the room, you can send her a WhatsApp asking them for their bank details. And then you guys can do an EFT or whatever, SnapScan they do nowadays, or checkbook. Have I still got a checkbook? No? Credit card, whatever. Sorry, I was back in the 70s there for a moment. So while you guys do that, come on, let's load that poll up so we can get an idea. But the most important thing is for us to see what type of giving you'd like to support Waves for Change. Gail's details is on your poll with her details, her cell phone number, etc., etc. So the next person is the co-founder, Safeguarding and Community Outreach Manager. Now, safeguarding is the word I'd love for him to explain. Apish Checha co-founded Waves for Change in 2009, which started as a small, informal weekend surf club. He grew up in Masiphumelele, one of the smallest and most underserved townships in Cape Town, as we know. Apish is an advocate for inclusive sports and provides access to safe spaces for township participants. He is a youth worker, mentor, child protection officer, and community outreach manager. Please welcome to the stage, Apish Checha.
This is huge. I get nervous to stand in front of the crowd. But yeah, good evening, honorable guests, partners, donors, ladies and gentlemen. Tonight, our team, Ways for Change. Where's Tanya? Ways for Change are greatly honored and humbled by your presence tonight, particularly your support in our work. I would never thought, like 12 years ago, that our self-therapy program would impact the life of many children and young people in our communities. And tonight, it demonstrates that our work is changing lives. Tonight, I've been tasked to vote the thanks to the specific people. A big and a huge thanks to our guest speakers, Ms. Nashan Pitton. Is she around? Oh, she has left. And I would like to call Tanya to hand out the flowers. But we'll keep them. Okay. And Ms. Stella Mukatini. They're both from Department of Health. And an event of this nature means there's quite a lot of work that goes behind the scene. And to make event great success, I would like to acknowledge and thank you the following people as well. And the next person is a big thanks to event and relationship manager. I don't know who you're gonna give, who's gonna give you flowers. But that's Tyler Bailey. And for your dedication, your commitment, and impressive execution for tonight's event. Thank you so much. Oh, where's Nick? Ms. Nick Nomnikelo, from the MEV, our director, monitoring, evaluation, research, and learning. So big thanks to you. Also a big thanks to Mr. Ezra Overbeck for emceeing tonight's event, for keeping us on track and also keeping us on timelines. Thank you so much, sir.
Thank you very much.
We really appreciate you.
Thank you very much.
And I would like to mention Overtech Solution. Thank you so much, guys. A special thanks to the following people: Paula Yaru, Gail Summers, Robin Cole. Who's Robin? How's it? Oh, there you go. Thank you so much. Tim Konipe. Where's Tim? And go as fit. Finally, thanks to the board for their ongoing support. I know some of the members are here and some of the members are not here, but thank you so much. And I don't know, maybe our coaches, I so wish they were here. A big thanks to our coaches. I don't know who's gonna pass the message. Please. And thank you so much for attending, guys. And I think we've got some snacks outside. Enjoy the evening. Thank you.
Thank you, ladies and gentlemen. Thank you, Apish. There's some wine outside. There is food outside. There's some wine outside.
The infrastructure in my community is very bad. Most people live in